Um, Thank you all for being here and having me here. And thank you, Yuria, for kicking it off. So we've all gathered here to look at how AI is going to be promising in all the industry domains. And as I come from healthcare, today's agenda for me is I want to discover together with all of you what AI can do to healthcare. So I would like to start with sharing some of the problems that the healthcare industry has. So one of the major challenges of our industry is that we have aging population all over across the world. And by 2050, the current aging population will become double, and we'll have 2.5 billion by 2050. So it impacts healthcare costs, as well as the working population will be lower by 25%. The second industry challenge is demand versus supply. Whereas there is an increase of lifestyle diseases, chronic care diseases, and all the other kind of diseases which are kind of new diseases like cancer and other stuff, we have so many people undergoing, who are wanting to have healthcare treatment. At the same time, our population of medical professionals, doctors, nurses, paramedic staff is not coping up from numbers perspective. So there's a wide gap, whereas on one side we need them, on the other side we don't have them. And the third and one of the major challenges that almost every healthcare institution in the world faces is the data is sitting in silos. There are duplicate records. There is disconnection of patient records sitting from one place to another, and how do we collect all of this? And we also see there is a shift in healthcare happening. So there are a lot of other industries like retail. We've seen Amazons of the world and Netflixes of the world who are causing a lot of disruption in the industry, and healthcare is no different. And what we see is that the patient is becoming more savvy. Patient wants to take care of and control his own healthcare and not let his healthcare to be in the hands of doctor alone. While we do get our shopping delivered at home, can't we get healthcare delivered at home? So there's a distinct shift happening where healthcare is moving or would move in future from hospital to home care. So far we all have been measuring the sickness, how sick somebody is. This is going to shift to measuring prevention. So like if today when I drive my car, I let my fuel meter tell me how far away I can ride on the car with the existing fuel that I have in the car, and it prevents me from taking the car beyond when my fuel cannot let me drive it. So that's called prevention. So likewise, the healthcare will shift, and it will shift to show us as patients to see how far away and how distant we are from figuring out before we get ill. So that's prevention. And then there is a shift which is happening from patient to population. So today, it's one size fit all treatment that patients undergo. Tomorrow, the population will be stratified based on the risks, and there'll not be one size fit all phenomena from a treatment perspective. So looking at the models in the healthcare, so if we go back almost a century, and we see the first bit of the century, the healthcare models specifically worked on the products. There were healthcare institutions which were maternity and care, pediatrics, cardiac super specialties, etc. And then there was an era almost about 50 years back, in some countries 30 years back like India, where apart from the products, there was a line of services that got into it. When we say services, these are, can I have insurance covering my health care? Can there be a cashless service provided by the healthcare provider? So the models shifted from not just having the product, but having a layer of services on top of the product. Now, in the recent past, since about 2010, etc., we are seeing the S-curve of healthcare industry has taken to the next dimension, where we're using information technology in a larger way to make changes in the models. So whereas we have products which are same, we have insurance which are services. On top of this, we now using IT to let patients know when their appointments will happen, to let patients know they have an immunization, so there is a reminder which they can see on their mobile or on the emails. And we also have at some places where electronic medical record is being shared with patients on patient portals. And some of the institutions that we work with, they are providing this EMR diagnostics results of x-rays to the patients. So by the way, I'm just taking a step back to introduce some of the work that I've done, so that kind of I can dovetail with the presentation that I'm making. So I've had the opportunity to work with the likes of Stanford, Johns Hopkins, Mayo College, etc. In US, and also to work with NHS in UK. So I've been working with healthcare industry, health tech industry to be precise, for more than 30 years. So looking at the models now, this is the time that we see the S-curve is going to take one more dimension beyond IT, and that dimension is going to be AI. So you know what, I just wanted to share something with you. My daughter, she suffered with a fingernail injury almost a year back, and it's been and her eye got into corneal erosion. So this was a very, very recurrent phenomena, and for last 1 year we've been changing doctors, we've been changing treatments, and so every time there's a treatment change, we come back home and we only hope and pray to God that this treatment works. So it's a hard and it's very, very a difficult proposition to be a patient in any country. The reality is that I'm aware of an Uber car will reach me in time. I'm also aware of the recommendations that Amazon gives me for my shopping, but I'm actually not aware of whether the treatment will work for me or not. And the reason is not just my vitals, my blood pressure, my blood glucose levels, my other vital parameters, height, weight, etc. There are so many other variables on which my healthcare depends. Not only just the genome apart from my other vitals, but if you look on the screen, there are what is my behavior, what are my diet adherence patterns, what are my medical adherence patterns, do I take my drug in time, is there an activity that I have my body undergo, what is my nutrition, what are my exercises level, what is my psychology, am I going under stress, so on and so forth. These are those variables which are very, very important for healthcare industry to be able to get us to know whether the treatment will be right for me or not. Hence, there cannot be a situation where a treatment which is one size fits all can be a proposition for healthcare. So when we talk about variables, and I think my colleagues here, the data scientists from both the universities, and I have professors, they'll all concur with me. When you have a problem in any industry which depends upon so many variables, that is the piece of problem where, applying mathematics, we could reach there. And looking at the variables from healthcare industry. It is, at this point, the healthcare industry at its cusp, where we're trying to understand what are the models that can be put on number of variables to be able to get to a predictive artificial intelligence kind of a solution which can indicate us, like the Google Maps indicate us what's there next that we are going to face on the road. So having said that, so this is the base, and this is what I think as industry professional, that where the industry is going. So we took this as an example, and almost about a year and a half, we took about 7 variables to manage the disease, which is very, very popularly known, and almost about 63% of world's population today undergoes and suffers either they have a propensity to develop the disease, or they are already into that disease, and this disease is called diabetes. So what we did, we took 7 parameters, and of those 7 parameters were my blood glucose level, both postprandial and fasting, my blood pressure levels, both systolic and diastolic, my diet pattern, my exercise pattern, and my whatever food I was intaking. So basis that, we created a platform, and the heart of the platform, we put an analytics engine. So on this platform, we onboarded the patients. Those patients were given the devices by which they were able to see, or they were able to, these devices were Bluetooth enabled, and at least 4 times a day, every patient was asked to use those devices and send us the data, and that data got into cloud using the mobile devices that the patients had. And in that cloud, we ran some analytics engine, and that engine was able to give us the stratification of the diabetes population that we tried to manage through the platform. And when we look at the stratification, this stratification was based on the models that we put on the AI. And when we looked at the stratification clearly told us who are the patients who were at the risk of suffering from retinopathy, nephropathy, neuropathy, and some patients about to get amputations. And there were some patients who were just just trying to get just entering into the diabetic disease. So it clearly indicated doctors and care providers to, change their treatment levels, and so much so that there were patients whose HbA1c score is a score which tries to tell you what is the level of diabetes that you have, and to be able to remain free of diabetes, that score has to be less than 6. There were some patients who were able to be brought from 13 to 6, and that was a great success factor, I would say. So what I'm trying to say is that whereas this is an unmet problem of the industry, whereas we do not know how to take care of diabetes, it has started to become an epidemic for the era that we live in. On the other side, using AI, we were able to figure out what the solution was. And as I said in my previous slide, that there are doctors who are less in number. The idea here was that the complexity of the variables that was sitting in figuring out the treatment for diabetes, we could simplify those complexities, and we were able to give the treatment in the hands of a care provider team who were not doctors, who were paramedic staff. Looking at the thresholds that the AI engine threw, that some patient was about to get into the next level of diabetes, they were able to do the interventions in time. The treatment could get altered. The patients were reached out to say, well, you're not exercising. Some of the patients reached out to say, hey, what did you take an hour back? Your blood glucose levels have risen up. So patients could get control of their own healthcare, as well as we were able to manage the healthcare with as less as cost that we could have imagined. And the doctors who were needed for, they usually give 15-minute slot for one patient. My one care provider team could take care of 250 patients with the one paramedic staff. So it's a panacea. I mean, I think the unmet problems in healthcare industry which are sitting there and not letting this industry grow, I see great potential in AI letting us solve these issues. Now, when I look at what the patient would be of tomorrow, I simply kind of relate back to, how do I do shopping today on Amazon? So tomorrow's patient, for tomorrow's patient, there'll be 3 E's which will be very important. One is elevating, which means if I have the self-knowledge, through self-monitoring, I will be a quantified self. I will be able to see myself differently. My body talks to me and I don't listen to my body today because I cannot amplify those signals by which my body is trying to tell me what it is undergoing. When I become quantified self, I should be able to take leverage of such signals and be able to take care of myself. Second E is enabling patients. So I said, tomorrow's or future models of the healthcare industry will not only depend upon just the care providers who are doctors, but there'll be multiple other people who would be able to help the industry. It's exactly simpler, like, I would like to give a simile here. So the cars that you drive, the engine, the combustion of the engine and the way engine works is a very complicated process. And people who understand the mechanics would concur with me that there are a number of polynomial equations running behind. But can you imagine that the same engine can be treated by a roadside engine mechanic? Because, why is that possible? Because the complication or the complicated logic sitting in the engine has been simplified and kind of democratized so that anyone can take, with minimum amount of training, is able to take care of that problem. So likewise in healthcare industry, the smart care teams are going to take it over from doctors in the near future. The third E is empowering. So with the devices that I talked about earlier, and I also talked about amplifying the signals of life or amplifying the signals of body. These are the devices which would become very important and they will empower the patient. So look at the patient of tomorrow. He's a quantified self. There are smart teams. He can leverage any of these technological improvements that we're bringing in hardware to be able to kind of fuse and let us know what is the biology running in his life and in his body. So let's look at what are the delivery models of the future going to be now that we know patient is going to be a quantified self. So the patient gets to choose what his packages should be, how much price he should be incurring, what is the outcome of the healthcare services that he chooses, and healthcare providers like hospitals and other players of the industries will have to ensure that those outcomes are available and delivered. With this, I would want to take you to what healthcare industry is and what are those early innovations that are happening using AI, and what are those early entrants who have already gotten into and trying to help us. So if we look at the healthcare industry, there is a fair segmentation. We have payers and providers. Providers are the ones who are doctors or hospitals or small care teams. Payers are nobody but insurance organization. Then we have diagnostics, which are labs and radiology. We have, sorry, I can't read from my system here. We have pharma, who are in the business of manufacturing drugs. We have health IT, who are in the business of creating analytics around and creating or managing the patient experience, if you will, using the technology. So let's look at where what is happening. So just follow with me. The reds are the payers and the providers, and those are the areas listed in front of you where a lot of AI innovations are happening, and they are all trying to figure out what are those variables around which we can create a solution to the problem. The next level is the grays. These are the diagnostics, the imaging, the blood transfusion, etc. So a lot of research is happening on X-rays and CTs and MRIs. Is there, so for example, Google is working a lot on figuring out a cure for retinopathy. Retinopathy is an ailment of an eye which happens to be to the diabetic patients, and it is one of the largest cause of blindness in Western world. So a lot of research is happening there. Using AI, one is able to predict what is going to be the status of the blindness in retinopathy. Then we have the darker green, which is access to patient data. So we here healthcare IT, the IT which is sitting in hospitals, they want to create better experience with the patient using telemedicine, a lot of apps and wearables. Then we have medication design, which is based on molecular biology. So you're all familiar of clinical trials. So slowly pharma industry is moving to clinical trials with not having the patients endorsed for clinical trials, but looking at the diverse data which is sitting with us and with the various organizations by using AI and coming out with, you know, what could be those future drugs that could help do the treatment. And then the last one is drug discovery. I think I just mentioned about the pharma. So now taking to the next slide, and if we look at what are the barriers today, before I talk about the barriers, I think there's one comment that I want to make. It's a perfect, BitCrit and this World Forum is a perfect forum where we're bringing academia, industry, and together to understand how we can use data sciences and AI to kind of treat the unmet problems of the world. At this time, there are a lot of barriers. People think that can AI replace doctors or AI will replace doctors. I think I will argue it differently. We have all seen doctors using stethoscope, and stethoscope comes 200 years since it was first discovered. It works as a tool and helps doctors to diagnose. Tomorrow's AI is going to help as a tool which will help the doctors to diagnose better and provide us with better treatment. Current barriers are because people haven't seen it. There are quite a number of work that has to be done. So I would say we need to be watchful of 30s. People who are below 30, which is our student, academia, startups who have less than 30 employees, and the next 30 years which are going to change the world using AI. And I think BitGrit has brought a perfect platform where we can create the talent pool by bringing academia together. We can also create a marketplace where the AI tools that are the academia develops can be taken up to the market, and we could democratize AI, which means we can simplify the complications sitting behind the AI, the variables that nobody has to deal with. And with, I think, I will close today's lecture. If you have, I don't know how much time is left, but if there is a time, I'm open to taking questions. Thank you so much.
Thank you. Thank you very much, Ms. Mukta. It was very interesting lecture, right? So let's move on to the question and answer session. Please say a moment. Okay. Please raise your hand when asking a question. Does anyone have any questions? Someone? Okay.
Am I audible? Yeah, I have two questions. First is when you conduct trials like you did it for diabetes, what are the ethical considerations that you take in to consider in the ethical?
Right.
And the second thing is there is a Supreme Court judgment of 2013 or 14 which says that you cannot have a treatment running remotely by a doctor. So in that particular case, it's not for the case of diabetes, but in general, how does the AI engine or data analytics takes care of the remote and home therapy part?
Right. I'll take the first question first. So from ethical standpoint, I think the first ethical question that comes is protected healthcare information. So the first ethics which we have to take care is protected healthcare information. It's called PHI. So every patient has the right to protect his healthcare information. To be able to provide PHI, we anonymize patient's data. We remove the identity of the patient. We only take the vitals and then treat those vitals against the models. Those vitals, etc., are the variables on the models that we talked about. The second question was the healthcare provider has to be there and the treatment cannot happen remotely, right? Is that the question?
Yes.
Absolutely right. You're spot on. The healthcare provider has to be there. So when we say smart teams do have, okay, by the way, this question arises when we talk about telemedicine, you know, can I as a doctor treat a patient who's sitting remote from me? Well, the answer is that no, the patient has to be with a healthcare provider on the other side. This healthcare provider could be a trained nurse, could be a paramedic. It need not always be a doctor on the other side. And when we talk about care teams, the care teams work on the principle of first getting trained. They are all paramedic staff. First getting trained, and second, there are levels of interventions that we devise for this, the teams. So there is a level at which they reach out to the patient when they don't have to give any advice to the patient on medical terms, but they need to give advice to the patient on adherence terms. For example, a patient skips taking a drug in time, so this is the team which intervenes and says, well, hey guys, you've not taken your treatment, so don't expect there is going to be an efficacy of that drug. The second level of intervention where the disease pattern crosses a threshold when there is a medical advice due, that is the time when doctors really come in and give the such advices. So what we are trying to do is we are trying to stratify the interventions to best utilize the time that the doctor has. Any more?
Okay. Thank you so much. Thank you for answering the question. Okay.
Thank you for...
Short question, okay.
Short question?
Yeah.
Okay. Oh, so I'm a little bit concerned about the social welfare expenses. So so let's consider about example that one woman or like has a or like has a 90% breast cancer possibility, and in that case, maybe for the 10%, maybe she doesn't have her breast cancer, but the AI says that she can have a breast cancer, and in that case, you think the government should pay should pay some money to have some medications or like surgery. Recently the cost of drugs are getting increasing, right? Since the molecules are getting bigger and larger and made from proteins. And in Japan, it is getting a very huge problem that the social welfare expenses are getting larger and larger. So if you take account for those potential problems, I think the expenses will get more larger and larger.
Absolutely right. So I understood your question in two ways. One is, should government pay for treatment, right? The answer is yes, because it's a social cause. But the stress on the GDP of healthcare costs is so high that even governments can't do it. So through my example on management of diabetes, so I come from Dubai, and managing 1 year of treatment of diabetes takes about $1,559, to be precise, dollars to manage a patient for 1 year. But when we applied this AI tool, we reduced the cost that we incurred to manage one life from $1,559 to $300. So that's the answer. So AI will help us to provide better outcomes and better cost. So as I said, we need to be watchful. It's just the beginning. Next 30 years are going to be AI. And to your question, that the women that had breast cancer, 90% of the times she had. So I think once the AI matures, we may not reach to that level where somebody will suffer from a cancer. So when when I talked about prevention, we could prevent it from happening altogether. So that's where we are entering. This is the era we are entering into. Thank you all.